A very warm welcome to all of you. There is a world of difference between the knowledge you gain from books and the wisdom you receive from experience. And to fill this gap, Sitaram Research Foundation initiated AACHAARA. This is a continued medical education program for Ayurvedic practitioners as a part of Sitaram Ayurveda's 100th year celebration. With 19,000 plus participants, 150 plus speakers, 175 plus different topics, and 100 plus clinical sessions, AACHAARA has been a huge success and has contributed significantly in helping Ayurvedic doctors embark on a lifelong learning journey. With this CME, Sitaram brings together excellent minds on Ayurveda whose rich expertise in clinical practice will contribute to your growth and learning. Sitaram started its healing journey in the year 1921 with a state-of-the-art GMP certified manufacturing plant, government-approved R&D laboratory, super specialty Ayurveda hospital, and an NABH accredited Panchakarma retreat. Sitaram continues to serve people with the ancient healing powers of Ayurveda. Thank you for joining us in this episode of AACHAARA. You will be receiving the show notes, certificates, webinar recordings, and the latest updates onto your email and WhatsApp. To receive the latest updates and newsletters, please send a text to 8943 441 881. For more details, log on to our website www.sitaramayurveda.com and welcome to AACHAARA.
Good morning all. Welcome to the 245th episode of AACHAARA, a CME initiative by Sitaram Ayurveda Research Foundation. Today we have our topic management of liver disorders. And we have our eminent speaker, Dr. Jithesh M.K, the Senior Medical Officer, Kottakal Arya Sala, who is the HOD of Quality Control Department. The sir will join soon. Then today, myself, Dr. Anujoy, the moderator of the session. I am the Research Officer, R&D Department, Sitaram Ayurveda. Dear participants, due to some issues from the technical side of our speaker itself, he is unable to join now. He will join soon. And I am welcoming all participants who are present here to attend this webinar. Today our topic is the treatment of liver disorders. As we all know, the liver is the very hot topic in between the allopathic doctors and the Ayurveda doctors. In Kerala, there is a doctor who is allopathic. It's known as liver doc. He's always chilling against the Ayurveda, saying that our Ayurveda medicines will cause the liver damages by using the Ayurveda medicines. So, the liver topic, the liver disorders and the liver ailments, the diseases that are occurring in liver, and the relations, how we can treat in Ayurveda in case of liver disorders. Today, the topic is very relevant because of the today's present situation in this world. So, I am welcoming all participants to be present here to attend this webinar. Those who are having any doubts regarding Sitaram Ayurveda and Sitaram Ayurveda products, you can comment on the chat box. I can answer to your questions. Our speaker will join soon. Dear participants, there is one question from Mahesh. Can you please elaborate regarding the Shiva Gulika, its indications, dosage and uses? It's sure. In today's product presentation, we are having the discussion regarding the Shiva Gulika. Our Shiva Gulika, we are preparing it as per the classical mentions. And we have tested the fulvic acid, and which is the main active component of the Shilajit, and which is very present in our Shiva Gulika, Sitaram Ayurveda Shiva Gulika. Then in our product presentation, you can see the fulvic acid values and the effectiveness also. Then Mahisha Dravagam is available. Yes, we have Mahisha Dravagam. And we have published one article regarding the Mahisha Dravaga and the presence of the calcium in the Mahisha Dravaga and the standardization of Mahisha Dravaga. You will get the articles from the Google Scholar itself. Then next about Ksheeraguluji capsule, we have a Ksheeraguluji capsule that's known as KG101. It's soft shell capsules where the Kshira, Tilataila and Guruji are the components. And the 101 times we are repeating the procedure, means Avarti. We are doing the procedure, and that's why it is very much potent, and it is indicated in the osteoarthritis and osteoporosis conditions, and in arthritis conditions also it's having very good result. And we have published one article regarding the Ksheeraguluji via GCMS study, where we have noticed around 39 ingredients, active ingredients. Most of them are indicated for the anti-inflammatory and analgesics properties. So that shows the effectiveness of Ksheeraguluji in the anti-arthritis in arthritis condition, and also the osteoarthritis conditions also, osteoporosis conditions also. And one request is from Dr. Sushil, the clinical trials of patent products. Now our Sitaram Ayurveda Research Foundation is very much keen to do the clinical trials for our patent products. And you can see our published articles in the Google Scholar and from our website also. The website is under the revamping, and after the completion of the revamping, you will get the all links from the website itself. And you can see we are doing the clinical trials, and the articles are also published. For example, the digestive sap Narasimham, then infla sap, sapsayachain. These are our patent products where we published the research articles with the clinical studies itself. Then another question is how we can get our medicines from in the Karnataka. In Karnataka, in Bangalore, we are having our branch. Then during our product presentation, you can contact. There is a number of Mr. Rajiv, our customer relations manager. You can note down the number and you can contact him for any helps from the Sitaram Ayurveda regarding any queries and the availability of the Sitaram products. The indication of Mahishadravaka is another question. Generally, the Mahishadravaka is indicated for generally for the Vadavyadi conditions. So based on the Mahishadravaka, along with the other Arishtas or Kashayas, can recommend for the Vadavyadi disease conditions. Any queries or any information if you are need from the Sitaram regarding the Sitaram Ayurveda products and the availability, you can contact our customer relations manager, Mr. Raju. I will put his number on the chat box. You can contact him directly. Dear participants, our speaker is trying to join. Due to some issues from his side, he is unable to join. He will join in a while. So during that section, I think we can go for our product presentation, and those who are having any doubts regarding our products and requirements, etc., you can write on the chat box. I will clarify your doubts. So let me share my screen for the product presentation. Hope my screen is visible to you all. Dr. Ruma, can you please verify whether my screen is visible or not?
It's visible.
Yes, it is visible.
Okay, sir.
Please continue.
Okay, thank you. So let's move on to our product presentation. Today, a 245th episode of Acharya Rasayana, and we are dealing with the liver disorders. So I'm starting with the first product, that is Kaudaja Triphala, which is a unique combination of Kaudaja, which is a curry leaf, and the Triphala that helps in weight management. Then it helps in sustaining the digestive fire and the metabolic functions. As we know, our liver is the main metabolic organ. So this Kaudaja Triphala will help to regain the metabolic functions and to normalize the metabolic function. The Kaudaja Triphala is an avaleha preparation widely used to prevent and manage the lifestyle disorders. The sweet taste makes it highly palatable also. Then our next product is Inflasap, which is a comprehensive relief of inflammation that is related pain. This 1 gram tablets is featuring with the 30% of glucosamine sulfate for maximum efficacy. And it is recommended for the pain related with the inflammation conditions. It is recommended 1 to 2 tablets twice daily. And we can see that the Inflasap tablet is having the blend of Shalagi, glucosamine sulfate, and Rasnairandadi Kashayam base. And it is designed to effectively combat the joint inflammation and improve the mobility. It enhances the joint and tissue functions, and it's effective in all inflammatory joint disorders. Generally, 1 to 2 tablets twice daily is the dosage. And we have published one article, which is the standardization and scientific validation of the Inflasap tablet, an Ayurvedic anti-inflammatory tablet. The Inflasap, where the 17 herbal ingredients, where the Alpinia galanga, Boswellia serrata, Dastis Shalagi, which demonstrate exceptional quality and safety as an anti-inflammatory formulation. We have completed the organoleptic, physicochemical, microbial, heavy metal toxicity, and GCMS study also to standardize this Inflasap. And these all results confirms the sensory acceptability and the physical stability, microbial safety, and the no presence of the heavy metal contaminants in the Inflasap tablet, and which is very potent in anti-inflammatory phytoconstituents are present in the Inflasap tablet. And in GCMS study, we have identified 15 constituents, which are most of the compounds are having the anti-inflammatory pharmacological actions, which proves that the efficacy of Inflasap tablet as an analgesic and as an anti-inflammatory remedy. And this is the article which is published in a journal, that is the International Journal of Ayurvedic and Health Medicine, which is a peer-reviewed journal and having a high impact factor also. And second article is published in the International Journal of Ayurveda and Allied Science, where it is a clinical study. In that pilot study, the 15 subjects were included with the inclusion criteria and the medicine is provided for the 30 days. And the result was such a wonderful result that in pain intensity, edema, tenderness, and muscle spasms, we will get a good result with the Inflasap tablet. The mean score of the pain intensity has reduced from the 1.8 to 0.26, and the edema has reduced to 0.66 to 0.06, and the tenderness also reduced from 0.86 to 0.46. So, most of the patients has got a good result from the Inflasap tablet. So, the mean score has improved from the 30.4 before the treatment to 36.6 after the treatment, signaling 11% increasing the musculoskeletal health and general quality of the life in 30 days of the treatment. And this is the research work which is available in the Google Scholar also. Second, our product is Sitaram Cardiosep tablet, which is take control of your blood pressure and stress naturally. That's regulate the blood pressure, reduces the stress and the anxiety, and support the arterial health also. And Cardiosep is a blend of the Sarpagandha, Arjuna, Lashuna, and natural helps to control the hypertension and related issues. It's also act as a stress reliever and formulated with the Sarpagandha, Arjuna, Lashuna, Shankapushpi, and more combining the traditional Ayurvedic herbs for the heart health. It's also having the diuretic effect also. The dosage is 1 to 2 tablets twice daily. And our next product is Shivagulika, which is elevated with the traditional Ayurvedic wisdom. The key ingredients of Sitaram Ayurveda Shivagulika is the Shilajit Rasayana, Jivaniyagana, and Gomutra, and also having the Ashwagandha, Bala, Guduji, Triphala, and Dashamula, along with the Kshira, Madhu, and Taila, etc. So the key benefits, or we can say that the indications of the Shivagulika is a revitalizing and rejuvenating formula, holistic bone benefits, and promote the longevity and strength. And we can also recommend in the diabetic cases also. The dosage is 1 gulika twice daily. Then this is the fulvic acid content in Shivagulika, which is the main active component of Shivagulika. The presence is 1.26%, which is good for the recommended dosage. And what are the benefits of the fulvic acid? It is act as an antioxidant, and it's also act as an anti-inflammatory, and it supports the immune system, and it also regulates the metabolic activities and improves the digestive health, skin and wound healing, and the neuroprotective effect. So we can say that in the liver conditions, liver metabolic conditions or liver disorders, we can recommend this Shivagulika. The next one is Mr. Sneham soft shell capsule, which is treat the habitual constipation by in dry bowel and difficult bowel or constipated conditions, and the medications induced constipation conditions also we can recommend the Mistraga Sneham. It's also effective in circulating, increase the blood circulations and to relieve the indigestions and flatulence and bloating, etc. Then the dosage of Mr. Sneham in adults is 1 to 2 Mr. Sneham capsules at bedtime or early in the morning as recommended by the physician. It's balances the three doshas also. This is the detailed clinical study of the Inflasap tablets which we completed. And another product, our project is Yogamridam, where the classical yogas, Kerala classical special yogas are mentioned, where the major ingredients indications are mentioned with the clinical experience of our eminent Vaidyas also. Then to know more about Sitaram Ayurveda, you can log on to our website www.sitaramayurveda.com. You can also purchase the medicines from our website also. And we are sending the e-certificates to the participants who are present here more than 75 minutes. And if you are not getting the mail, you can check other folders also, like a spam folder, promotion folder, etc. To get any support from the Sitaram Ayurveda, you can contact our email ID support@sitaramayurveda.com. And please send your name and location to this number to get updates about the AACHAARA Rasayana. That is 8943441881. To know more about Sitaram Ayurveda, to get any supports from Sitaram Ayurveda, you can contact our customer relations manager, Mr. Rajiv, 9072613194. Email ID crm.osk@sitaramayurveda.biz. Thank you. So welcome, sir. Welcome to the AACHAARA Rasayana. Jithesh sir, am I audible to you?
Yes, yes.
Okay, sir. So can we move on to the section?
Yeah, sure. 1 second. Yeah, let me.
So dear participants, our eminent speaker, Dr. Jithesh sir is here, who is the Senior Medical Officer of Kottakal Arya Sala, who is the HOD of the Quality Control Department. And to a few words about Dr. Jithesh sir, Dr. Jithesh M.K. is the physician of Kottakal Arya Sala, completed his BIMS from the Rajiv Gandhi University of Health Science in the year 2004, and soon he joined the Kottakal Arya Sala as assistant physician. Later, he went for his postgraduate studies in the same university with the subject Rasashastra and Bhakshicha Kalpana. Then presently he is working as the HOD in Quality Control Department and handled more than 100 cases ranging from the national and international levels in the field of Rasashastra. He has to his credit 7 articles in various reputed peer-reviewed journals, and currently he is doing his part-time PhD in Kanchipuram University. Welcome, sir. Welcome once again to the AACHAARA Rasayana. Welcome, sir.
Yeah, very good morning. Sorry for the unexpected delay from my side because of some technical issues. I'm really happy to be associated with the prestigious institution once again. So I think during the first phase of this seminar, the third or fourth class, I had an opportunity to handle as a resource person. It was the topic of allergy, probably in the year of 21 December or somewhere. So anyway, I'm really happy to work for being invited as a resource persons. So especially this Ramanathan sir and everyone, we are always interacting with the great personality like him for many, not only the clinical side, but the same time the depends upon the different kinds of from manufacturing areas also. So without wasting much time, I think I can share my PPT, right?
Good morning, doctor.
Good morning, sir.
Good morning.
Oh, yes. Sudhana, sir.
Oh, Sonali, Sitaram. ഞാൻ കാഞ്ഞങ്ങാടാണ്.
ശരി സർ.
ഇവിടെ ഒരു നിത്യാനന്ദ സരസ്വതി സ്വാമികൾ ഒരു അവാർഡ് തരുന്നുണ്ടെന്ന്.
ശരി സർ. വെരി ഗുഡ്. കൺഗ്രാറ്റ്സ് സർ. So let us go. And I think this is the best time to speak about the liver disease. There are two reasons. One, we are celebrating the hepatitis week now. And the another thing, there is a dilemma that all that medicines, Ayurvedic medicines, in most of them Ayurvedic medicines cause either renal or some kind of liver damages. So it's our duty to explain or to convince not only the public, but the upcoming Ayurvedic physicians also regarding the safetyness as well as the efficacy of the our Ayurvedic medicine. So usually we all know.
Dr. Jithesh, one more point.
Sure, sir.
That is, in Malayalam, liver is Karal. Then Karal means friends. So today is a friendship day. So the liver is the most friendship organ in our body, sir.
Wow, nice interpretation, sir. Never thought such a way. Thank you very much. So let us come back. Thank you, and Ramanathan sir. So again, let me come to the topic. So what I'm planning to do is, so we know that liver or hepatology is a very vast topic, ranging from a simple uncomplicated jaundice, hemolytic jaundice, to the more complex liver cirrhosis or the end stage liver disease or something like hepatic coma, etc. So it will be a difficult task to compile everything, all these topics in one session. So I prefer to include, to stick on more the common diseases, especially this kind of the different kinds of hepatitis, etc., and the other the non-alcoholic, the fatty liver disease, etc., which is very common nowadays. So now, without wasting much time, that we will move. So actually, what is Kamala? So most of us will be wondered that we have been listening this Kamala from our first year BAMS class, again in Roganidana class in the second profession, as well as in the different phases of Chikilsa also. So actually, what does it mean, Kamala? Whether it is a hepatitis or jaundice, or is there a difference between jaundice and hepatitis? So I'm trying to compile some cases, some around 10 cases of different types of hepatitis, where we have to follow different kinds of management. The pathology is different. That means the symptomatology is different, and obviously then the management is also different. So what does it mean? So let us see. Let us go to little bit in our own textbooks. So we will see to the classics from let us start from our second profession, BAMS. I don't know now that it's not the professional system, but I'm not in academy, so I'm not much familiar with the academic system. But let me compare with my time. So actually, what is this? Hepatitis is Kamala or jaundice is Kamala, or whether both are same or different. First, we have to think what is the difference between jaundice and hepatitis. Then only we can reach to a definite conclusion as well as a definite treatment protocol. So now we will just see how we can manage or how we can diagnose or what is the difference between both. So we have learned two types of Kamala, right? Kamala Bahupittesha Koshtha Shakhasraya Mata. So what is Koshtha Shakhasraya? How many types of Kamala are there? Some of us might have learned that there are two types of Kamala, that is Kosthashrita Kamala and Shakhashrita Kamala. Is it right? No. Kamala Bahupittesha Koshtha Shakhasrayamata. Of course, there are two types of Kamala. One is Shakhashrita Kamala, that is Kevala Shakhashrita Kamala. And the another one is Koshtha Shakhashrita Kamala. It's not Kosthashrita Kamala and Shakhashrita. So we know that where this Kamala is being manifested, right? Let us go to the Nidana first. Vyayamam amlam, lavanani madhyam, mridam, divaswapnam, ativa tekshnam, nishevyamanasya vidushya rektam, dosha tvacham panduratam nayanti. Right? So this is the Panduroga Nidana. Those who are indulging in Vyayama, Amla, Lavana, Madhya, Mrida, Divaswapna, etc. Nishevyamanasya vidushya rektam. Those who are indulging in this kind of Nidana Sevana, in that persons, the Rekta will be vitiated, and then that vitiated Rekta gets manifested in Tok. Dosha Tvacham Panduratam Nayan. Right? So Tok is Rasadhatu. And the Dhadu, the other Dhadu vitiated here is Rekta Dhatu. So what is Shakha? Shakha Rektadi Dhadavas Tokcha. So all the Dhadus can be included in Shakha. So without an involvement of Rekta and Rasa, a Kamala cannot manifest. That means without the involvement of a Shakha, Kamala cannot manifest. Please don't think that Shakha, the Shakha what we mean in the Rachana Sharira. That means the Dve Bahu, Dve Sathi, one Andaradhi, etc. we have learned in our Rachana Sharira. But this is not that Shakha. This Shakha clearly refers to the Dhatus. So here, without the involvement of Rasa and Rakta, a Kamala cannot be manifested. And hence, obviously we can say that without the involvement of Shakha, a Kamala cannot manifest. And thereby, the classification as what we learned the classification as Kamala is of two types, Kosthashrita Kamala and Shakhashrita Kamala is wrong. Kamala is two types. One is Kevala Shakhashrita Kamala. That means without the involvement of Koshtha. Different kinds of infective jaundice, or infective hepatitis. There is no involvement of Koshtha here. And the another one is Ya Pandurogi Tvatyartham Pittalani Nishevati Tasya Pittam Asrik Mamsam Dagtva Rogaya Galpati. Right? This is the Kamala Sampradaya. A Pandurogi, again, if he is indulging in Pittala, Pitta Varthaka Ahara Vihara, his other dhadus also. Ya Pandurogi Tvatyartham Pittalani Nishevati Tasya, that person Pittam Asrik Mamsam Dagtva Rogaya Galpati. So again, we are going deeper thought. So this is Kamala. This is Koshta Shakhasrita. So Kamala is of two types. From now onwards, Kamala is of two types. One is Kevala Shakhasrita Kamala, and another one is Koshta Shakhasrita. Now, let us see what Chakrapani says. He makes a wonderful observation regarding the classification. So if we learn or if we read that classification or the logic put forward by Chakrapani, what we can do, we will never mislead in our management. Let us see what he's saying. Chakrapani again classify this as two. That is Swatantra Kamala and Paratantra Kamala. See, this is the importance that this classification is what we needed for a clinician, not an academician. Probably we may feel that this Chakrapani classification, etc., are more important in academy. What is the relevance of this in clinics, in our patients? When the patient comes, can we think of Chakrapani, etc.? Of course, I'm not saying that we have to think regarding this Chakrapani always, but still, his concept should be clear in our mind. Now we know that there are two types of Kamala. Shakhasrita Kamala as well as Koshta Shakhasrita Kamala. Now we will see what is the classification of Chakrapani. He classifies as Swatantra Kamala and Paratantra Kamala. What does it mean, Swatantra and Paratantra? Swatantra is independent and Paratantra is dependent, nor non-independent. So can you just think, we have the previous classification now, right? This Kevala Shakhasrita Kamala and Koshta Shakhasrita Kamala. So out of this, which is Swatantra Kamala and which is Paratantra Kamala? So you may think that I'm deviating from the clinical side, but absolutely no. These are the basics. And so whatever the points, the clinical points which I'm going to develop from here, is definitely it's based on this concept. So first, the foundation should be clear very much. So out of this, what could be Swatantra Kamala and what could be Paratantra Kamala? Right? Yeah, I'm getting some. Let us discuss. Yeah, who speaks in, yeah, right. Ruddhapatha Kamala, syllabus not required, sir. It's not syllabus, sir, actually. So I think without explaining this, I'm not able to proceed further. This is what. So I think you will change your minds once you reach the final of this presentation. Okay. So, right, what? So here, yeah, I'm getting the Swatantra may be Shakhasrita and Paratantra may be Koshtasrita. Exactly, that is the correct sign. So, without knowing this, we cannot develop a protocol. If we are developing a protocol, I would say it's absolutely a wrong concept. That's the importance of this theory in our clinics. Without Ayurvedic theory, a clinician cannot build his practice. So, right. So let us see, go back. So what is Swatantra and what is Paratantra? Here, the Swatantra Kamala, which is independent Kamala, we can say as the Kevala Shakhasrita Kamala. As I explained, I put a word in the middle that is some kind of infective hepatitis, which doesn't have much relation with the Koshta. So the Agantuja. So here, the Swatantra Kamala is Kevala Shakhasrita and Paratantra Kamala is Koshta Shakhasrita. That is the dependent one. So let us see what does it mean that how this Swatantra and Paratantra is relevant in our diagnosis. Again, let us go to Chakrapani. Once again, we have to. So the Paratantra Kamala is Panduroga Purvaka. So for developing this kind of Paratantra Kamala, there is a need of development of Pandu in the beginning. So we will just see. This is the most, I would say, this is the most important line in the entire Pandu Kamala chapter. Chakrapani classified this as Koshta Shakhasrita Kamala, Bahupitta, and Panduroga Purvaka. That means, which is the Paratantra Kamala. And Shakhasrita Kamala, Alpapitra Swatantra Bhavati. See, I think now the previous question which I posted in the chat box got some relevance. It's not simple theory. So the Bahupitta, one Kamala is Bahupitta, that is which is of Pitta predominance. And the another one is Alpa Pitta. So how can we adopt the same management in both? One is Pitta predominant, the another one is Pitta, which has got least predominant, or Pitta is in the normal stage. Can we follow the same protocol in both? No. So from now onwards, whether it may be hemolytic jaundice, whether it may be alcoholic hepatitis, whether it may be infective hepatitis, or whether it may be obstructive hepatitis, whatever it may be. So our diagnosis should be whether it is Bahupitta, Panduroga Purvaga, Koshta Shakhasrita Kamala, or Alpapitta, Swatantra Shakhasrita Kamala. So that should be our diagnosis. If we stick on this diagnosis, so the further concept gets clear. So in clinical point of view, so there are three types of hepatitis. Yeah, I'm seeing this some questions regarding Ruthapata Kamala. Ruthapata Kamala is another entity that we will discuss in the previous slides. So this is the hepatic classification, the classification of hepatitis in modern system. So it has, we all know that the hepatitis has been classified into three, that is pre-hepatic, hepatic, as well as post-hepatic. So out of this pre-hepatic, which is produced due to the overproduction or impaired uptake by the liver, or there is no involvement or there is no much kind of involvement to the liver. The liver is not being affected in that case. So from this, we can say as Bahupitta Panduroga Utpanna Koshta Shakhasrita Kamala is hemolytic jaundice produced due to hemolytic anemia. That is Yat Pandurogi to Atyartham Pittalani Nishevate. That is produced from the Pandu. Pandurogi to Atyartham Pittalani Nishevate. Tasya Pittam Asrak Mamsam Daktva Rogaya Kalpate. Such a Kamala is Panduroga Purvaka, that is hemolytic jaundice. And now we will see what is Alpapitta Swatantra Shakhasrita. Different kinds of, maybe hepatitis A, B, C. Everything we can, that is infective, which is independent in origin. So the everything we can consider as the Alpapitta Swatantra Shakhasrita Kamala. So now let us go to the detail. So I think this we will deal with the cases. Now we will see the first case. So I think I shall go through the questions which has been till now. Okay, so the case number one. A male age 35. So now let us see how we can interpret the previously explained fundamental concepts in the patients. or how we can fetch the previously the fundamental concepts of Ayurveda into Nidana or Sutra Sthana to Nidana Sthana. So a male aged 35 years complains of fatigue, palpitation and shortness of breath and anorexia since 1 month. He had same kind of episodes 6 months back, which was treated by modern medicine. On examination, severe anemia and mild icterus were noted. So you just think these symptoms: fatigue, palpitation, and shortness of breath. Anorexia since 1 month. The same episode was there, which was treated by modern medicine. So what's we are suspecting some kind of jaundice. So what kind of test we have to do? So you can just see picture. Here, in this case, you can see his sclera is not sunset yellow, but it's mild. There is the pallor is there. And when we go to the blood analysis, his hemoglobin found to be 8. Bilirubin is increased 3.8. And all the other parameters are normal. So now let us see the result. Hemoglobin is 8, 3.8, and the other thing. So from this, what could be our diagnosis? I think you can have a trial from what we learned till now. Okay. The diagnosis is hemolytic anemia with hemolytic jaundice. That is not sufficient actually. For doing Samprapti Vikhatana, we need to read in Ayurvedic terms, right? Then only we can select the proper medicine. So here, the hemolytic anemia with the hemolytic jaundice, that is Bahupitta Panduroga Purvaka Kamala. So this is a Paratantra Kamala, which has been originated from Pandu. The initial pathology was anemia. And from that anemia, because of the hemolysis, lysis in the sense destruction, abnormal destruction of RBCs or heme molecule, the symptoms like jaundice is being manifested. So this is hemolytic jaundice, Bahupitta Panduroga Purva. So what could be the pathology here? Abnormal destruction of RBC, leading to increased breakdown of hemoglobin, again leading to anemia, and from this anemia there will be the manifestation of jaundice. So destruction of RBC. Let us see the Samprapti of Pandu here. Vata Pitta Ahara Vihara, right? Vyayamam Amlam Levanani Madhyam Mridam Divasopnamadiva Tekshnam. From this Nishevyamanasya Vidushya Rektam, there will be the increased production of the destruction of this RBC, etc., or Rekta Dhatu. There will be the Kapha Vata Rekta Vritti finally, which leading to Pandu. And here there is another condition called as Ashayapakarsham that we will discuss later. This is a specific kind of dosha gati which is being explained in Madhukosha commentary of Madhavanidhana. So here actually there is no qualitative increase in Pitta. What happened here is Pitta is being increased, but it's not qualitatively, only the quantitative increase is happening. That means if you are adding water to milk, what happened? The quantity of milk increases, but the quality is getting decreased. The same pathology happening here also. The total amount may be increased, but the quality of Pitta is being reduced. So what happened? What is this Asyapakarshagati? Here also, This is also very relevant in clinical point of view. That means here what happens means there will be the Vata Vriddhi in Koshta. You can see this Nidana of Pandu, Vyayamam, Amla, Lavanani, Madhyam, all causes both Vata Pitta Vriddhi. So here what happened is because of the Vata Vriddhi in Koshta, this Vata is getting dispersed the already Sthanika Pitta to the Shakha. So the Shakha, there is no much quantitative, there is no much what we say the qualitative or the increase in the Pitta because of the excessive Jaliya Guna Vriddhi. The Pitta gets its flowness is the flowing tendency is increased and that will be dispersed along with the cooperation of Vata. Samanasthameva dosham swasrayat akrishya vayu sthanantaram gamedi samanasthameva vikaram janeti. This is the typical example. So here the treatment should be given not to Pitta but to Vata. Vata should be the treatment here. So how to understand whether it is Asyapakarsa Gadi or the simple Pitta Vriddhi? Of course, there will be the Vata Vriddhi symptoms in Koshta along with the Pitta Vriddhi Lakshana in Shakha. So the icterus or the yellowish discoloration, especially in the Shakha, in the skin, etc., indicates the Pitta is being lodged or displaced from Koshta to Shakha. At the same time, there will be abdominal distension, regular constipation, and sometimes irregular bowel movements, and sometimes vague abdominal colics, etc., indicates the Vata Vriddhi in Koshta. So if these two are combined, it should be understood that here the pathology is Asyapakarsa, and here and thereby the treatment should be given as Vata Anudomana. So now let us see. Sampraptiya. From that Pandu, the Pandurogi to Atyartham, again he is taking Pittalahara Vihara, Pittalani Nishevate. Tasya Pittam Asrik Mamsam, the Tasya Asrik Mamsam, the Twaroga Helpati. So here the Vata Pitta Samana, Deepana, Anulomana, and Shita Virya as well as Stampana to arrest the further progress. So what medicines we can give here? See, usually the medicines what we give like Patolakadrohinyadi or Vasha Guluchadi or some kind of what we say, even this kind of Arogyavardhini, etc., will not be effective in this kind of cases. Because here the pathology, the treatment should be Vata Pitta. So the medicines like Drakshadi or Punarnavadi or Ardhavillam, or there is a medicine Kashayam called as Vyoshadi Kashayam or Karimbirumbadi Kashayam. So these kind of medicine Kashayams will be more effective in this. There are some conditions where Patolakadrohinyadi or Vashagulujyadi, etc., to be given. So that we will discuss later. So we will see. We will have a critical analysis of this Kashayam. So Drakshati, Punarnavadi, Ardhavillam, and Vyoshadi. So we know this Drakshadi is Vata Pitta Samana. Then the further indications like Jwara, Madateya, Chardi, etc. So probably we can give this as Bahupitta, Panduroga Purvaga, Kamala, or hemolytic jaundice after initial Pachana phase. This Drakshadi does not have a property of Pachana or Dipana. So better in the initial phases, this Drakshadi better not to be given. So for first phase, you can start with either like this Pachanamrita, etc. Or if this Agni is normal, or the symptoms there is much of severe symptoms like severe burning sensation or different severe amlapitta, this heart belching, etc., heartburn, etc. So you can adopt this condition, these medicines in the initial phase. Otherwise, better not to start in the initially. And then where we have to use this Punarnava. Punarnava Nimba Patola Shunti, Tiktamrada, Darvi Abhaya Kashaya. And the indication Sarvanga Shupodara Gulma Shulam. Shwasanyudam Pandugadam Nihanti. So again, the Pandu is there. So if the patient exhibit the symptoms like generalized edema or even maybe localized edema, so you can go for this Punarnavadi. Along with the severe Agnimandia, this Punarnavadi can be. And Ardhavillo. Ardhavillo is also almost we can consider as a big brother of Punarnavadi. Half part of Ardhavillo Kashayam, the quantity half part is nothing but Punarnava, which is more of Srotoshodhana as well as Pachana in nature. So the same condition with more severity, you can go for Ardhavilya, and with lesser severity, you can go for Punarnavadi. Now, Vyoshadi, which contains iron as an ingredient. So this is also Kapha Samana in nature, Kapha Vata Samana in nature, not like Vata Pitta Samana. But still, if the patient exhibit the symptoms like severe Agnimandia, Aruji, etc., we can go for this, what we say, the Vyoshadi Kashaya. Now let us see what are the herbo-mineral drugs we can use. We have learned in the Agrasangraniya, that is Ayoraja Panduroga Jnanam Seshta. So different combinations of iron containing medicine. Swarnamakshika, Kasisa, Lohavasma, Mandura, Gairika. See, all are different forms of iron. But there are some differences. We cannot substitute one with other. If we don't have Swarnamakshika Vasma, we cannot substitute with Gairika, or we cannot substitute with the Mandura. Chemically, we can say these are all more or less similar. But according to us, the Ayurvedic pharmacokinetics are entirely different for all this. So we'll just see. This is the difference. So you can see this Swarnamakshika, Kasisa. Kasisa is nothing but Annabhedi Sindhura. So Swarnamakshika is Kapha Pitta Shamana. Kasisa Vasma is Vata Kapha Shamana. Again, Lohavasma is Kapha Pitta Shamana. Mandura is Sannipada Shamana. And Gairika is Pitta Shamana. See, according to modern science, these are all different kinds of iron compounds. But for us, these are all different. So if a Panduroga, so to be precise, if a Kamala Rogi, or that is a Panduroga Purvaka Paratantra Kamala patient exhibit the symptoms of Kapha Pitta predominance, that is the Aruchi, Agnimantia, Alasya, Jwara, along with Amla Pitta or burning sensation in all over body, etc., or generalized pruritus, etc., we can select this Swarnamakshika. This is how we have to diagnose the Kapha Pitta Lakshana in a disease. And we can go for this Swarnamakshika. If the patient, if the Panduroga Purvaka Kamala Rogi or Paratantra Kamala Rogi exhibit the symptoms like generalized pruritus, again Agnimandia, Jwara, along with abdominal distension or constipation or irregular bowel movements, we can go for Kasisa or Annabhedi. The same condition with Swarnamakshika, which I explained for Swarnamakshika, we can adopt this. Either we can substitute this Swarnamakshika and Loha maybe. But there are some difference. Swarnamakshika is Ushnavirya and Loha is Sitavirya. Now Mandura. Again, it is Katu Vipaka. So little more Pachana as well as Sroto Shodhana in nature. If the patient exhibits severe burning sensation, severe acidity, severe belching, what amlika, hritkantadaha, etc. he exhibits, then we can go for Gairika. Or not only this Gairika, the medicines which contains Gairika, that is Kamaduga Rasa, Lagusuta Shekhar Rasa, even Pushyanuga Churna, etc. we can use in this condition. So the dose can be except Gairika. All the other we can give 125 to 250 milligram, depending upon the Anupana. Now, different preparations, let us see. There are two different combinations we can utilize in this. One is Dhatri Lauha and the another one is Taramandur Vataka. Both are different, but we can use in this condition. So let us see Dhatri Lauha, which contains Dhatri, Loha Basma, Yeshtimothu Churna and Guluchi Sorasa. So from this itself, from the ingredients itself, we can identify what could be the property of this Dhatri Lauha. So Dhatri Lauha is Pitta Shamana and Pandu Roga Shamana. It's not Deepana or not Pachana. Now, the dose can be in adult 1 to 2 tablets, children 5 to 8, below 5 to 18, 1 tablet TDS. For children 1 to 5, half to 1 tablet. So the indications can be hemolytic anemia or hemolytic jaundice with Paithiga Lakshana like burning sensation, excessive thirst, high temperature, delirium, etc. Maybe iron deficiency anemia with the Punarnavaswarasa can be given. Severe ecterus, it can be given with the Bhangarajaswarasa. Now, see the other one, Taramandura Vataka. So previously the ingredients were Dhatri, Loha, and Guluchi Sattva and Yeshtimatu. So this is the entirely opposite, but both are indicated in Pantu only, right? So this is the beauty of our formulations. This is how our acharyas formulated the drugs. The properties as well as the qualities of both the drugs are entirely different. So what does it indicate? So it's our freedom, the physician's freedom to select which medicine has to be to go for which medicine. So that selection should be based on the patient's symptoms. We should be able to reach to a conclusion, and then we have to select. So here the ingredients are Vidanga, Triphala Churna, Trikatu, Gomutra, Mandura Bhasma, and Guda. So all are Tikshna, Kaphavata Shamana in nature. More of Pachana and Deepana in nature. So what could be the probable indication? So let us see. The dose can be the same dose only. Now, hemolytic anemia with the jaundice, with Kaphaja Lakshanas like loss of appetite, lethargy, indication, and the indigestion and irregular bowel movements. So if the condition is similar, but the pathology is different. According to us, the pathology is different. So this is how we have to analyze critically the medicine selected. Now, Dhatri Lauha maybe 250 to 500 milligram. In this case, in the initial phase, and Taramandura Vadaga can be given. Either that also is possible. In the first Agnimandya phase, we can go for Taramandura Vadaga. And once that phase is over, then we can switch over to Dhatri Lauha. There is also a possibility. Here, the Vyoshadi Kashaya was selected and Taramandura Vadaga was selected. So previously, it was the HB was 8.1, which increased to 12.3, and the bilirubin reduced to 0.5. Now, another case. A 58-year-old male presented with complaints of generalized pruritus and clay-colored stools. This problem started with fever, malaise, and myalgia. Personal history, he has an history of alcoholic. Family history, nothing relevant. So what could be the diagnosis here? What is the point of relevance. The diagnosis. May feel as the clay colored stool is a misleader, right? There are two conditions where clay colored stool can happen. One, we know Tilapishtanibham yastu kamalavan sajermalam, that one. And the another one, that means if the channel has been blocked, there is obstructive jaundice. And the same thing, the production of bilirubin is reduced. Again, then also we can get the same clay colored stool. So by observing the clay colored stool only, we are not supposed to reach to a conclusion that this is an obstructive jaundice. So you can see this. The bilirubin is 5.6. The direct bilirubin 3.2. And you can see this SGOT and SGPT. SGOT is 1120, 1020 to 120, and SGPT is 1673. So we know this AST and ALT are liver enzymes which are produced by liver. So these enzymes are increased when the liver is being infected. But usually don't worry, even though the normal range says as 25 to 50 or 30 to 60, etc., depending upon the labs. But still, there are some criteria. There are some red flags where we have to suspect the infection. So if it is below 100, better don't worry about this OT and PT. So always this is the step. This is the phase. So SGOT should be greater than 500. SGPT should be greater than SGOT. And SGOT and SGPT should be greater than 8 times. Then only this OT and PT becomes alarming. If it is simple 75 or 80 or 100, etc., better don't worry about that. This can happen because of any kind of minor infections also. So just keep in mind that is, if the OT is above 500, PT should be greater than OT, and OT and PT should be greater than 8 times increased than the normal. This indicates, so you can just see, we have to suspect any kind of infection. Then we can go for a further analysis. If such a parameter, if we are observing, it's our duty to see whether what kind of infection is this. This can be hepatitis A, B, C, etc. So we have to go for a viral assay. And here it was the HAV, that is hepatitis A virus, was increased. So this is the diagnosis is acute viral hepatitis, that is Alpa Pitta Swatantra Shakha Shatakamala. Previously was Bahupitta, and here it is Alpa Pitta. So what could be the difference? What difference we should make in our management? So here the Samprapti is Pitta, Kapha and Vata, the Dushya, Rasa, Rakta, Mamsa. The Srotases involved are Rasavaha and Mamsa and Raktava. Dushti Karana is Atipravritti and Vimargagamana. Udbhavasthana is Amasya, and Vyaktasthana is Netra, so Mukha and Nakha. Haridra Netra, etc. So the protocol should be Pachana, Tridosha Samana, mainly Pitta Kapha Samana, Krimihara, and Rekta Prasadana. Absolutely and opposite to the previous slide. So this is the importance of theory. So the medicines like Nimbadikvatha, Pathyakshadhatryadikvatha, Vashaguluchadikvatha, Halatrigadikvatha, etc. You can see this. All these four, there are 4 medicines. with almost similar combinations, but the indications are entirely different. One is Nimbadi Kotha. The second one is Patyaksha Dhatrayadi. We know this Patyaksha Dangam or Patyaksha Dhatrayadi. The third one is Vasha Guluchyadi. And there is another one, Phalatrigad. So let us see the indication. You can see these ingredients. Vasha Guluchyadi. Vasha Guluchi Tribhala Katvi Bhunim Baja. And the indication is Pandu Pittasra Kamala. And the only one difference with Vasha Guluchyadi and Patyaksha Dhatrayadi, one or two different, that is Vasha Guluchyadi and Patyaksha Dhatrayadi. In Patyaksha Dhatrayadi, there is Amrita and Nisha, which is being, in case of Vasha Guluchyadi, it is being replaced with Katurohini and Vasha. With the the change of two medicine, the indication differs completely. We know this Patyaksha Dangam, Urdhagam Rektabittam Cha. So here, and the another one is Nimbadi Kwatha. Again, that also, the difference is only one or two drugs, but the indication is entirely different. That is, the indication of Nimbadi Kwatha is nothing but from Kushta. There is another one with the say almost similar combination. That is Nisotamadi. Nisotama Nimba Patola Patram. Tiktavaja Lohida Yashtigabi. So again, this is also indicated in Nihandi Kapapitta Kushta. Kapapitta Kushta. There is one another Lekhu Manjishtadi. Manjishta Tribhala Tikta Vacha Darunishamrata. Again, the combination is almost similar. So, but the indication is Vatarekta and Kushta. So all this can be taken depending upon the conditions. So this is how, with the omission as well as addition of one or two drugs, this is the art of changing the indication different. So the another group we can select this Patyaksha Dhatrayadi, Patola Kadrohinyadi, then Guluchyadi, again Nimbadi, etc. So where this Patola Kadrohinyadi is indicated, usually we select this Patola Kadrohinyadi in, or generalize this Patola Kadrohinyadi mainly, right? So according to the Siddhanta or pathology, this is Kapapitta Samana and Visham Vami Marochakam Kamalan. So the infective hepatitis with more Kapha symptoms is the only indication of Patola Kadrohinyadi. If it is of the same kind with more of Pitta symptoms, we can go for Guluchyadi. If the infection is severe, we need more of Krimi Shamanatva or antimicrobial property. We can go for Nimbadi as an option, even though the indication is entirely different. So what are the RASA drugs we can use? Again, here we generalize the drug called Arogyavardhini. We give this Arogyavardhini in almost all the jaundice, many times. But absolutely, this is a very wrong concept, because if you analyze the ingredients of Arogyavardhini, it contains all the hepatotoxic. You can see Rasagandhagaloha Bram, Shulba Bhasma Samamshakam, Triphala Duguna Prokta, Trigunam Chashilajatu. Almost all Rasa Gandhaga, Loha, Abhra, Tamra Bhasma, then Shilajatu, Chitramulam Chatatsam, this what we say, Erandamula, or some companies manufacture as Chitraka also, and Kadurohini, Tikta, Kadurohini. So almost all these drugs are hepatotoxic in nature. But then what could be the probable indication of this Arogyavardhini? The Arogyavardhini is Tikta Rasa, Krimi Shamana, Pachana, as well as Klayada Shoshan. So according to my concept, or not only my concept, according to the theory, the indication of his Arogyavardhini is nothing but a simple infective hepatitis only. We are not supposed to give this in any other conditions. So the dose can be 250 to 500 milligrams. In children 5 to 18 years, 1 tablet TDS, 1 to 5, 1 tablet BD. So this is the first drug of choice in hepatitis A, maybe with anupana like Vashaguluchyadi, Pathyakshadhatrayadi, Punarnavadi, etc. So you can see this previously. "54-year-old, another case, the third case. Male with progressive abdominal distension, upper right abdominal pain, non-specific malaise and jaundice. Patient is chronic alcoholic. And physical examination, positive for jaundice and a mild painful hepatomegaly was associated. So you can say this patient. On examination, his bilirubin was 15. Direct bilirubin was 6.5. OT and PT 250 to 150. And alkaline phosphatase 110. So except the bilirubins, almost all the other parameters were almost normal. So the diagnosis is alcoholic hepatitis. Again, here the management is entirely different. So what are how can we correlate with the positive, the probability? So these are the different pathologies happening in the alcoholic hepatitis, in the liver of alcoholic hepatitis patient. So the toxic effect on cell membrane by this alcohol. So we can consider this as madhya or visha and agam. Hypermetabolism, as I explained, vata pitta vriddhi, that is nothing but ashayapakarshana. Then the third cause is generation of free radicals, nothing but dhatupaka. And reduced immune factor is nothing but avarabala. So madhya act as visha, which leads to pitta vriddhi, leading to dhadupaga, which reduces bala and leading to kamala. So the samprapti is different, and then the pathology also, the treatment also should be different, right? So the protocol here is vada pitta samana, shita virya, yagrut uttejaka, and rasayana. Absolutely different from the previous protocol. So what medicines we can use here? Normally drakshadi or modified drakshadi. There is one drakshadi called as diguna drakshadi. That is in the drakshadi kashaya, the draksha takes as in the double quantity. Or here we can use this Vashaguluchyati. Or even Dashamulam Kashayam, etc. gives much result, usually gives much result in this kind of condition. So in the Rasa drugs, Yashadabhasmam initially and the Saptamrita Loham seems to be effective in this case. Later status Rasayana therapy. So this Yashadabhasma, let us see, it's zinc oxide. So it is Ruksha, Lakhu, and Sukshma. And it has got a peculiar action called as Shleshma Kala Sankochakara. So almost all the soft tissues, see the liver is the most soft organ. So which causes the Shleshma Kala Sankocha, the edema of the Shleshma Kala, which reduces the edema. So that is the typical indication of Yashadabhasma. And it is Kaphapitta Samana, Pandu Samana, and Samaklama. So almost all this is both the antagonist to the or opposite to the symptoms as well as the pathology. So we can use this Yashadabhasma as in the initial phases. And once that first phase, that Kleda Shoshana is happened, then we can go for Saptamrita Loka. So this can be given, Yashadabhasma can be given with a dose of 125 to 250 milligram. There can be some mild gastritis, but absolutely rare possibility. I never experienced the adverse drug reaction with Yashadabhasma in my practice. So because zinc is the micronutrient of our body. So Saptamrita Loka. So the ingredients are Mathukam Triphalachurnam, Ayoraja Samam Pibe, Yashtimathu, Triphalachurna, and iron. So how many drugs are there now? Only 5, right? Then how come it is Saptamrita? Madhukam, Tribhalachurnam, Ayoraja Samam Pipe. There are 2 more. That is Madhusarpiyutam Samyak, Gavyam Kshiram Pipetanu. So the ingredients are Madhuka, Tribhalachurna, Lohachurna, Lohapasma, and then Madhu and Ghata. And this Anupana is Gavyam Kshiram, that is Gopkshiram. So 1 to 2 tablets BD or twice thrice daily, depending upon the severity we can give. See, this Saptamrita Loha usually we use very much, but we restrict this to Amla Pitta or this kind of eye disorders, etc. But this is how we can extrapolate this if we understand, we analyze the ingredients in detail in many other conditions also. Saptamrita Loha is a wonderful drug of choice. So we can give this in alcoholic hepatitis with Bhangaraja Swarasa, iron deficiency anemia with Punarnava Swarasa, hyperthyroidism with Rakshadikwatha, etc. So you can, there is one tablet, I think that TA tab, Tribhala Churna and Annabhedi, Tribhala Annabhedi by Sitaram, I think. So that also is a wonderful drug of choice in this kind of alcoholic hepatitis. Usually it gives result. The Tribhala Annabhedi tablet. So in this case, initially the Drakshadi Kashaya, Avibhatti Churna, Yasada Basma was given for first 2 weeks. Later, Drakshadi Kashaya and Saptamrita Loha with the Punarnava Surasa for 1 month. So it reduced to 2.5 and again became normal. Now, 60-year-old male presented with complaints of progressive jaundice, anorexia, and generalized pruritus. Here comes our clay-colored stool again. On examination, palpably enlarged gallbladder and liver. So what we should do here now? Is there any need of any investigation, right? If we are palpating that, any further investigation is needed here? Let us see. So on examination, serum bilirubin came 750, 7.5. Total bilirubin is SGOT and SGPT. And this was almost normal, 75 and 80. But serum alkaline phosphatase was increased. All the other parameters were also normal. So what could be the treatment line? So the total bilirubin, we can see if the alcoholic alkaline phosphatase is increased and the other conditions were with the increase of total bilirubin, so we have to suspect and along with the clay-colored stool, we have to suspect the obstruction. So what could be the treatment principles here? Or before that, we have to understand, we have to identify the presence of obstruction. How much severe is there? And is there any possibility, if it is obstructed jaundice, is there any possibility to reverse that? So we have to go for an ultrasound abdomen. So in such case, it will be revealed that the partial obstruction of common bile duct. So what could be the pathology here? The diagnosis is partial obstructive jaundice with gallbladder sludge. So here the samprapti is pitta vruddhi initially, followed by the vata kapha. Dushya is rasa, rakta and mamsa. The srodasas are rasavaha, mamsavaha and raktavaha. Here the srodo dushti is nothing but sangha initially and then granthi. Dushti lakshana is kamala lakshana. So what could be the line of treatment here? Here is the most controversial principle in our science is explained, right? Tilapishta nibham yastu kamalavan srijetmala. kapena rutthapatam tat pittam kapharer. Acharya is explaining to reduce the pitta with kaphasamana group of drugs. How to do that? Tilapishta nibham yastu kamalavan srajenmalam. Kapharuddhapatham yastu tasya pittam kapharer. So we know this. The pitta samana drugs should be madhura rasa either or tikta rasa or kashaya rasa. Otherwise, and it should be Sita Virya and Ruksha Guna. But at the same time, Kattu Amla Rasa, this Kaphasamana drugs are Kadu, Ushna, Ruksha and Tishna Guna. How can we do this Pitta Samanatva with Kaphasamana drugs? So for that, we have to go for our Doshobakramaniya chapter again. There is a typical concept called as Gudha Pitta Chikitsa. Nigudha Pitta. He explained as Ashtanga Sangraha Doshobakramaniya. He explained as Pitte Nigudhe Andarn Vinikshide Tat Pittam Kadu Amla Ruksha Ushna Swedir Abhyavahacharet. If the Pitta, Nigudha Pitta is nothing but concealed Pitta. Concealed Pitta is nothing but obstructed Pitta. Isn't it? So, Acharya is taking support from the Sutra Sthana to the Chikitsa Sthana here. Tat Pittam Kapharer Jay is nothing but the Nigudha Pitta Chikitsa. So, there in the Doshobakramaniya chapter, Acharya is explaining to reduce the Pitta by Kadu, Amla, Levana, and Swedana, etc. It's not to reduce the Pitta actually, to remove the obstruction by Kapha or the Avarana by Kapha. The same principle he explained here also. Ruksha Sheda Swadu Vyayama Balanigrahe Kapha Sammurchido Vayu Yada Pittam Bahikshipe. Kapha Sammurchido Vayu Yada Pittam Bahikshipe. See the same concept which I explained in Asyabhagasha. Here the Kapha and Vayu are getting increased in Koshta and Pittam Bahirkshipe and expelling the Pitta from Koshta to Shaka. Again, that also is happening. Otherwise, that Pitta is being concealed by Kapha and Vadavati. So two types of pathology happening. So it should be here initially the treatment should be Kadu, Amla Rasa and Tishna Ushna Guna. Once that phase is over, then we have to go for Shida Guna, Kashaya, Tikta, Madhura Rasa, etc. So how can we know that whether the obstruction is removed or not? There also Acharya gives a clear-cut indication. That is, till how you have to continue the Kaphasamana Chikitsa. Apitta Ragat Shakrito. Till when the Shakrit regains the normal color. Up to that phase, you have to continue the Kaphasamana Chikitsa. Once the Shakrit regains the normal color, that indicates the flow is normal. The Rodha has been removed. And then we have to give Pitta Samana Chikitsa. So practically, how can we implement this? So we can manage very well the partial obstruction. But usually, if it is a complete obstruction, usually I use to refer. Because anytime there can be a bursting of common bile duct or cystic duct, etc. So it's better to refer in such conditions. Initially, Kaphasamana and Anulomana, then Pitta Samana. So this is the principle. When Pitta is under Nigudha and Vimargaga, this is known as Nigudha Pitta Chikitsa. So the first phase, the medicines like Patola Muladi, Chirivilluadi, Gandharvhastadi, Rasonadi, Dashamula Kadutrayadi, etc. All are Kadu, Tishna, Ushna, Ruksha Guna, as well as Sroto Shodhana in nature. Churnas like Vilangadanduladi, etc. We can use in the initial phase. And once that apitta raga sakrutau, then we can go for the, what we say, pitta shamanatva. And there is a combination which is popular in North India. It's known as Kalamekha Navayasa. This Navayasa Churna along with the Kalamekha Churna, that is Kirata Tikta Churna. It's in some areas in the North India, it's very common. Because this Kirata Tikta has got a specific property called as Pitta Virechaka. So that's what we need here. It's 9 part of Kalamekha Churna and 1 part of Navayasa Churna. Or even Tamra Bhasma also we use in the same. Known as Kalamekha Navayasa. So it is Srotoshodhana, Pachana and Deepana as well as Jurahara. So Kapha Pitta Rutham Tasya Tat Pittam Kapharer Jayet. We need that Srotoshodhana as well as Pitta Virechana in that condition. So this can be a better combination. Navayasa Churna with the Kirata 2 to 3 gram with the Takra. And second phase we can go for Kshara Parpadi. Once that first phase is over, then we can use the internal medicines also, like Drakshadi Kashaya, etc. We can switch over that. This Kshara Parpadi is also very common formulation. It's in powder in nature. It contains a safer medicines, contains Surya Kshara, Navasara and Sphatika. Even though it's indicated in Mutraghata, etc., it has got a very high property of Rasayana. So in this case, the first day Avibhatti Virechana was done. Then Patolamuladi Kashaya was followed. Along with the Kalyana Kshara and Jambira Surasa was given and Kalamekha Navayasa. In the second phase, it was Patola Kadru Hinyati, then Patyakshidhatriyadi, Kshara Parpadi, and Trivurt Lekhyam. So you can see this, the dilated scattered GB slit suggested the history of previous obstruction. So I don't have an experience with the management of complete obstruction. Only if it is completely obstructed, usually I refer the patient. "35 years, came to OPD with complaints of fever, vomiting, and anorexia since 3 weeks. On examination, conjunctival icterus, right upper quadrant tenderness, and generalized pruritus. Absence of normal colored stool. So what could be the condition? It's a complex situation, right? Now we will see. Let's see this. The report is not very clear, but still. Bilirubin is 5.0. Direct bilirubin is 2.1. OT and PT are 763 and 1100. Then the other serum alkaline phosphatase is also increased. GGT, that is gamma glutathione transferase. See, this alkaline phosphatase alone we cannot reach to a conclusion, because if increased alkaline phosphatase can happen in 2 other conditions, because it's an enzyme which is produced by the common bile duct. So not only that, the same can produced by placenta as well as any kind of this bone also. So in alkaline phosphatase usually can be increased in pregnancy as well as different kinds of bone metastasis also. So once the alkaline phosphatase is increased, so we have to confirm what is the reason for that increase. So we have to exclude the possibility of bone metastasis. For that, we can ask the patient for a GGT, gamma glutamate transferase, which is the specific test for obstructive jaundice. So here, there are 2 pathologies. Already the liver is infected. There is an infected liver along with the obstruction, right? So you can just see this. So the condition here is more complex. Already it's an obstructive case, but because of some other reason, the infection is also happened. So always here in this kind of coexistence can also happen. In such cases, always treat the obstruction first. our first priority should be to remove the obstruction. The liver infection can be managed later. Without without removing this obstruction, we cannot treat the infected liver. So always in such cases, if two conditions are coexisting, so always better to focus on obstruction first. And then once that obstruction is removed, that means apittaragat sakrato. Once the color of the stool gets regained, then go for the other line of treatment. So here you can see. So obstructive, here the diagnosis was obstructive jaundice with a severe hepatitis. It's a complex. Virejanam, Sramsanam with the Kadurasa predominant medicine. This is what I said. In presence of obstruction, that should be given the prime care. Then Sroto Shodhana and Pachana, later Pitta Kapashamana and Rasayana. So in a nutshell, I'll just, now we are ending the hepatitis session, and just we will go to the fatty liver. That's alcoholic, non-alcoholic fatty liver also the most common, and then we will end up. So in a nutshell, so reading this liver function test, usually we misses many factors, right? So I just compiled everything. So in case of hemolytic jaundice, total bilirubin will be highly increased along with unconjugated bilirubin. All the other parameters will be normal. In case of infective hepatitis, total bilirubin will be highly elevated along with elevated conjugated bilirubin, and the unconjugated bilirubin will not be much elevated. In case of alcoholic, again, total bilirubin will be highly elevated. All the other will not be much. In case of obstructive, the total bilirubin will be highly elevated along with conjugated bilirubin. But unconjugated bilirubin will not be that much. Now, the parameters, liver parameters. So hemolytic jaundice, OT and PT, and all the other parameters will be normal. In case of infective hepatitis, OT and PT will be highly elevated. ALP, GGT, etc. will be elevated little. In case of alcoholic hepatitis, OT and PT will be highly elevated. Not in the PT will not be that much. All the other parameters will be normal. In case of obstructive jaundice, OT will be elevated little, PT will be also elevated, ALP, GGT, and 5-NT will be highly elevated. So if we learn this process, this reading the liver function test, of course, we can exclude many risk flags. According to us, hemolytic jaundice is nothing but Bahupitta, Panduroga Purvaka, Paratantra Kamala. In nutshell, the protocol should be Vata Pitta Samana, Shita Virya, and Stampana. In case of hepatitis, this is the conclusion of whatever the topics which has been dealt till now. So in case of infective hepatitis, it is Alpa Pitta, Swatantra, and Shakhasrita Kamala. The treatment is Pachana, Krimihara, and Pitta Kapasha. In case of alcoholic hepatitis, it is Shakhasrita Kamala, that is Kevala Shakhasrita Kamala, Vata Pitta Samana, and Rasayana. And in case of obstructive jaundice, Shakhasrita Kamala, or maybe we can consider as Yagrutudara, normally, initially, Ushna Virya, Kapasamana, followed by Pitta. So we have concluded the hepatitis session. Now we will just see just two more cases. A non-drinker, non-smoker male, 50 years, complaints of fatigue, malaise, and dull right upper quadrant abdominal discomfort. Occasional steatorrhea was present and mild icterus was observed. What could be our next? And liver and spleen were palpable. And his blood report one, there is no much issues, but OT and PT was little bit increased. but not an alarming side. So USG abdomen, fatty liver grade 3 without displacement, enlarged prostate and grade 2. So is there a significance of this displacement? So if we ask the radiologist, usually they want, if we are suggesting an ultrasonography to a radiologist, they won't care much regarding the displacement. But if we are suspecting this fatty liver disease, we have to differentiate whether there is displacement is there or not. What is this displacement then? So we will just see. Is there a difference? Well, is there a whether that makes any difference with our management? Yes, of course. A fatty liver with displacement and fatty liver without displacement are entirely different according to Ayurveda. The samprapti is different, the dosha involvement is different, and then the treatment is also different. So here, how can we correlate, or to which disease we can correlate this displacement, fatty liver with displacement? So when we explain this udara, Acharya explained as non-alcoholic fatty liver, or this the plehodara, etc., or yagrut udara. There is no much different what we say the explanation we can get in yagrut udara, but we can see this as the of this plehodara. He explained as thana chudam amuktam cha. Whether it is thana chuta. So there can be, because of the excessive what we say, the further increase of weight, or difference because of the different surgeries, abdominal surgeries, etc. There can be a slight, because of the laxity of the ligaments, etc. There can be slight more displacement of the downward displacement for this liver can happen. So what does it mean? What is this thana chudam amuktam cha? So Acharya explained as, so we have to explain, we have to consider this as non-alcoholic yagrut udara with, there are two types, chuda and achuda type. Chuda is nothing but yagrut udara without with displacement, and achuda is with yagrut udara without displacement. So what does it mean? We will just see. The pathology here is, we know this steatohepatitis. So exact etiology is still undiscovered. The samprapti, it is vata pitta kapha, rasa rekta mamsa medas, then srodas, rasavaha and rektavaha mamsava srodas. There happens sangam and granthi. Dushti lakshana is yagrutpatti. So what is this the diagnosis here is yagrutudara. So rekta pitta samana, anulomana and rukshana and stampana. So again, Chakrapani explained this chuta variety is, chuta is rekta pitta vartaka, and chuta is vata predominant, and achuta is what we say is rekta pitta predominant. So if there is a displacement, there is an involvement of vata, and if it is not displaced, that should be considered as rekta pitta pradhana. So the medicines like Mahamanjishtadi, Pathyakshadathriyadi, or Guluchyadi, or Shonitamradam, etc., we can consider. Maybe Avibhatti Churna. Single drugs like Bhumyamlagi, Rohitaga, Punarnava, etc. And Kamadogarasam is an option here. Even Yashadabhasmam also we can consider here. Gairiga, Abhavasma, and Guluchi Sattva, etc. The dose can be 1 to 2 tablets twice daily or thrice daily. Anupanam depends upon the diseases. In this case, Pathyakshadatryadi Kashaya and Kamaduga Rasa was given for 1 month. So previously it was grade 2 reduced to grade 1, and later the treatment is still being continued. The last case. The case is similar. Non-drinker, non-smoker male, 50 years, complains of fatigue, malaise, and dull right upper quadrant abdominal discomfort. He was a chronic sufferer of abdominal distension since many years. Occasional steatorrhea was present. History of laparotomy. He had a history of laparotomy within a span of 5 years. And on examination, liver and spleen were palpable. So you can just, typically if you ask the radiologist to assess the displacement, they will write as like this only. So grade 2 fatty liver with minimal downward displacement. So this is a kind of NAFLD with or Yagrut Udara, which is of Chuta variety, that displaced variety. So the pathophysiology is almost similar. Samprapti here is Vatadhika Sannipata. Previously it was Pitta Rekta. The Dushya here is Rasa Rekta and Mamsametas. And Srotas are similar. Srota Dushti is similar. The Dushti Lakshanas, Yagrut Vritti and Yagrut Chutatva. Displacement. So the protocol here is Vata Pitta Samana and Anulomana initially. Then go for Rekta Pitta Samana and Ruksha or Kleda Shosha. So the first phase, medicines like Saptasaram, Sukumaram, or medicines like Ashtachurnam, Inguvajadi, etc., where we have to remove the Koshtavata Anulomana. Once that Anulomana is happened, gradually the ligaments or the etc., or even the liver gets the proper position again. Second phase, we can go for Drakshadi Kashaya or Vashabuluchadi Kashaya, etc. So fatty liver grade 2 without any evidence of displacement comparing to the previous report. Yeah, there is one. Yeah, cholelithiasis, the last one. Female aged 45 years came to OPD with complaints of severe sporadic colicky pain, mainly on epigastrium and right upper quadrant. Pain started after 2 hours of a heavy dinner. Pain started as a dull ache, which was relieving in an interval of 10 to 15 minutes and recurring after 45 to 60 minutes. She had 2 episodes of vomiting associated with dyspepsia and abdominal bloating. Diagnosis is acute cholelithiasis. The differential diagnosis can be acute pancreatitis, duodenal perforation, and acute gastritis. In almost all these 3 conditions, the symptoms will be similar. So it's our duty to go for an investigation. So here also, the treatment has to be divided into 2 phases. See, most of the cases, the gallbladder stone or cholelithiasis is being detected as an accidental finding, right? That is first case. The second phase is, the second group is, not phase, the second group is the symptomatic group. So the management of cholelithiasis in both the cases are different. So in symptomatic case as well as asymptomatic case. So that we will just see. So in case of symptomatic phase, we have to consider this as Pitta Rekta Vritti as well as Vata Prathalomana. So it should be Shopasamana, Pachana, and Muthavata Anulomana. In case of asymptomatic accidental findings, it can be Muthavata Anulomana, Pachana, and Kleda Shoshana and Shothana. Sorry, 1 second. Let me connect that. So it should be Muthavata Anulomana, Pachana, and Kleda Shoshana. So in symptomatic phase, we can go for the medicines like Mahamanjashtadi, Punarnavati, Saptasaram, etc. As well as for relieving the pain, maybe Ashtachurna, Ingvajadi Churna, etc. can be given. Or the medicines like Ponkaradi Guliga, Cherryandrakutharam, etc. can be an option. In case of asymptomatic phase, usually we need to focus more on Muthavata. It should be clear. The reason for the formation of gallbladder stone is nothing but it's a saponification process. There are different kinds of stones we know. Bilirubin stones are there, cholesterol stones are there, and mixed stones are there. So whatever may be, when a base is or a fat is mixed with an alkali, that is the reason for the stone formation, saponification, just like the production of soap crystals. The bile acids mixed with cholesterol, etc. And then because of the excessive reduction in the bile salt, there will be the typical reaction inside the gallbladder and the stone is. So the formulation of this Kalyanakshara or Palasakshara mixed with Eranda Thaila is one of the main ingredients, good medicine here. There are two medicines which is explained in Grahani, that is Padupanchakadi Gulika and Bhuktanjari Gulika. Both are found to be effective. This is explained in Ashtanga Hridaya Grahani Chikitsa, which is available in the market. Now, let me come. So, what I wanted to conclude, how I wanted to conclude it, Dilsayam Prathanam, Avasthanam Vidhanam. Whether it may be, there may be a theoretical exercise without the fundamental concepts, without understanding the fundamental concepts. If we are building our treatment protocol, definitely that will be not solid, that will not be that as strong as the protocol which was built upon a strong foundation. So there are so many other diseases also in especially with the liver disease, but still that can be that everything cannot be included in one class. So maybe we will have another. Then of course you can. This is the general protocol which can be followed in all the conditions, whether it may be cirrhosis or whether it may be any other malignancies or etc. So always consider this as the common protocol or the general treatment line which can be followed. So let me conclude once again, and once again I express my deep apologies for the initial issues with the connectivity. Once again, I express all the gratitude to the organizers of this webinar. Sitaram is doing a wonderful activity since 3.5 years. It's a continuous process, and I bow my head in front of the organizers for taking this endeavor upward. Once again.
Thank you, sir. Thank you very much. The session was very wonderful. And the takeaways, like the presentation was very useful by explaining the cases and the experience along with the treatment protocol. I'm sure it will be very beneficial for the all participants who are present here till the end. And when we consider from the first session, the types of classification, actually we are studied as Shagastrita Kamala and Koshtastrita Kamala, and your interpretation as the Koshta Shagastrita Kamala and Shagastrita Kamala was a new light to our knowledge. And I'm sure we can treat our patients with that concept. And nowadays we can see that the patients, those who are coming with with a USG scan report, we can see that everyone is having the fatty liver with a grade 1, 2, like that. So the importance of liver diseases or the Ayurveda treatment protocols have to be do something special in the liver conditions. So I'm sure the participants got a very good knowledge regarding the liver diseases, and they can treat their patients with getting the insights from this class. So now, sir, we can move on to the Q&A session. There is some questions in the Q&A box, and I request the participants, please write your questions and doubts in the Q&A chat box. We are only looking the questions from the Q&A chat box only. So, sir, can we move on to the question and
Yes, sir.
answers?
Definitely.
Okay, sir. So the first question is from Dr. Bindu. Sir, is the both Vashagulujyadi Kashayam and Palatrikadi are the same?
No, there are mild difference. One or two ingredients are different. Palatrikadi is both are different only, but we can substitute each other. There is nothing wrong.
Okay, sir. The next question is, can you explain the role of liver correction in connection with the diabetic and the dyslipidemic conditions?
Of course, we need to go for Kleda Shoshana, Pachana and Kleda Shoshana. Both this, whether it may be Pandu, whether it may be Shobha, whether it may be Udara, or whether it may be Prameha. So everywhere the Kleda is the main pathology. When Kleda is situated in liver, that became as maybe as Udara or any other conditions. When the Kleda situated Vasti, that manifests as Prameha. When Kleda situated in Tuk, that manifests as Pushta. When Kleda is situated in Garbhasaya or any in the what we say the Yoni, that manifests as Pradara. So the main pathology, the basic pathology is nothing. All over here is nothing but Kleda only. So always we have to focus on Kleda Shoshana. So the hepatic stimulation, what we say, in fact, that should be dealt by Pachana as well as Kleda Shoshaka. If the drug is Kleda Shoshaka, automatically that will act as Yagrututejaka also.
Okay, sir. I think the answer is clear. And the next question is regarding how to treat the high triglycerides and high LDL. So can we correlate like the Kleda Shoshaka by the same?
Pachana with the Tiktarasa. Tiktarasa Pachana. Pachana can be done with Kadurasa, Tiktarasa and Amla Lavanarasa. The Pachana, Tiktarasa Pachana Dravyas are mostly we can consider this as Sudarshana, Pachana Amrita, then what we say the Gulu, even Guluchadi, Tiktaga, Panchatikta, etc. we can consider as Pachana with Tiktarasa. And Kleda Shor in the Kadurasa Pachana are nothing but Panchakola, Shadharana, etc. But in most of the cases here, it should be Pachana as well as Kleda Shoshana. So the better option can be with Tiktarasa. Maybe with Pachana, initially we can go for Pachana with Pachana Amrita or Sudarshana, etc. And then if needed, we can go for Medohara medicines like Varanadi or Uplu Panchavala.
Okay, sir. The next question is from Dr. Stravani. How do we manage the alcoholic liver diseases in the initial stages?
Yes, that I think that I explained in the. I think this question might have been came before that case. That could be.
Yes, sir.
I explained during the class.
Okay. The next question is a case that is gallstones 8 mm seen in neck of the gallbladder. Sludge is also present. Curable with medicine or surgery. Sir, your experience in such cases.
Can you read once again, madam?
Yeah, sure, sir. Sir, it's a case of gallstones with 8 mm seen in the neck of the gallbladder.
Oh, okay.
Okay. This can be curable with the medicines or with the surgery. The doctor is asking your experience in such cases.
Oh, okay. No, actually the thing is, in case of gallbladder stone, the surgery is not an essential one. It most probably that will keep in long as silent one. So you can try for our medicines, as I explained in the group of medicines which are explained in the asymptomatic phase. Reduce much of fatty food. What happened? There can be an issue can be generated because the structure adjacent to gallbladder is nothing but cystic duct. The size of the cystic duct is around 1 to 2 millimeter. So if we give, or if the patient ask the patient maximum to avoid the fatty food, and if any kind of these fatty substances are taken more, there can be excessive production, and there can be a displacement of this stone to the cystic duct. Once that cystic duct, as the diameter is comparatively very less, there can be a blockage, and or even there can be a burst also. So always go for a reduced fat intake, and then the medicines which I explained in the asymptomatic phase, we can try for a period of 3 months. Probably we will be able to, probably most of the cases we are able to dissolve it. And the only possible way is dissolving it, not expulsion. Expulsion is not at all possible. So if it is in between, during this 3-hour treatment course, if any kind of cholecystitis happens, then better go for the surgery.
Okay, sir. So next question is from Dr. Geedu. Sir, with the SGOT and SGPT levels persistently elevated to 60 to 70 without any symptoms, so then other LFTs are normal range. So what are the potential causes for this?
The most common possibility will be fatty liver disease only.
Okay.
In most of the cases, is OT and PT will be around 100 to 200 range. The possibility is either alcoholic or non-alcoholic fatty liver. So go for a USG.
Okay, sir. Then, sir, is there any relationship between the elevated uric acid levels and the SGOT, SGPT levels?
I don't think so. I'm not much aware of that. I'll refer and tell you.
Okay, sir. Fine. The next question is regarding the how we can manage the hepatic hemangioma.
No, it's a asymptomatic case. Better not to interfere that. Okay. Keep it there. Let it be. If we are trying to manipulate it, or if we are trying to destroy it, there can be further complications. So let it be. Hemangioma, whether it may be skin, whether it may be liver or anywhere, better don't interfere with that. That's better.
Okay, sir. Sir, next question is from Dr. Pradhanya. That is, sir, kindly give the insights of drug-induced fatty infiltration of liver when the patient is on long-term antihypertensive and steroids.
You have to consider this as dushivisha. And so we need to go for proper shodhana therapy. And that can be if the parameters are not much elevated, or if the patient is not in a hepatic coma, etc. So we can try this, and we can go for the treatment. And be careful regarding the esophageal varices, etc. If in case of esophageal varices, etc., there can be a chance of again bursting, so that can be a complication. So only the complication can be this one. This can be, we can try this method.
Okay, sir. The next question is from Dr. Rajana Sharma. Sir, what is your preference? Sloha preparations or Mandura preparations in Pandu and Kamala cases?
No, depending upon the symptoms exhibited by it. That I explained, that if both are different, one is Kapha Pitta Shamana, the another one is Vata Pitta Shamana. So what is that we have to analyze the symptoms exhibited by the patient, and we have to find out which dosha is involved, and depending upon that, we have to select. There are conditions where Mandura has to be provided. There are some conditions where Loha can be given. There are some conditions where Purnamashya can be given. That's what the information which I shared in the first slide. If I don't know whether it is not conveyed properly. So that's what I meant anyway. So I think you can remind once again, that you will come to know what I explained.
Okay, sir. Sir, next question is from Dr. Anjali. In the case of the plan of treatment, in the case of asymptomatic hepatitis A antigen positive conditions, and is there any chance to become it negative?
Hepatitis A, asymptomatic.
Yes.
No, in case of hepatitis A, if it is asymptomatic, the normal proper rest with the proper fluid intake is sufficient. That will be normal.
Okay. The next question is from Dr. Sendil Kumar. Sir, is there any idea regarding the apple cider vinegar in gallbladder stones and bhumi amalaki and castor tender leaf preparations using in jaundice cases?
Apple cider vinegar is a bogus method. It's a magic. It's not a treatment. So I know that I've seen these cases. These some physicians are doing, but it's not right at all, because ask the patient to take this apple juice or apple cider vinegar, etc., for continue, then giving purgation. And the same what I explained this, there will be the saponification in the stomach, and the same kind of crystals will be formed, and that crystals will be expelled through stool. This is being identified as gallbladder stone. But actually, such therapies doesn't have an Ayurvedic support. So whether it is there or not, I'm not much aware of that. But actually, I don't think so. What is the need of such therapies? Just we can treat this according to our own principles.
Okay, sir. So next question is from Dr. Pushpaleda. Your experience during the pregnancy time, SGOT, SGPT, and serum alkaline phosphate elevated conditions, and what will be the treatment protocol for pregnant conditions?
No, in case of alkaline phosphatase, automatically that will be increased in pregnancy. That's what I said, that alkaline phosphatase is being secreted by placenta also. So that is normal only. In OT and PT, there can be fatty liver. That could be the reason. So better not to go for much medications during the pregnancy. Proper diet control will be sufficient. That, as I explained, reduce fat intake, do mild exercises, then increase fluid intake, and that alone will be sufficient. And once that pregnancy is a temporary period, right? So still we have got time to manage. So after that, we will after the labor we will start the treatment. That would be the better. Okay. And after delivery, alkaline phosphatase will be normal. That's what that also is.
Okay, sir. Then next question is from regarding after the jaundice treatment, most of the patients shows that feel of bloating and constipation. Is there any relation between the treatment and these conditions?
Yes, always. That's what I said. This is Koshta Shakha, Srata Kamala. If it is. Even if it is Shakha, Kevala Shakha Srata also, there can be a Vata Vritti in the stomach. So always it's better to incorporate a Vatanulomana Dravya during the treatment protocol. Anulomana can be different. There are two types of anulomana, Malanulomana and Vatanulomana. So Haritaki, etc. are Malanulomana. And this Hingu or the other kind of groups are Vatanulomana. So here this Vatanulomana has to be provided with the medicines like Ashtachurna or Ingojati Churna, etc. can be incorporated during the treatment. So gradually that will be controlled. And there can be another issue, that generalized itching all over the body. So that also within 1 or 2 weeks will be, if we give the proper anulomana, gradually tatrasthachavilamberin puyo hetu pradikshana te kaladivalam labdha upyandinyasayeshvavi is explained. Koshtam vayocha nigraha. Once the vayu nigraha from koshta is happened, automatically the expelled the doshas to the shakas will come to the koshta and conditions will be normal. So that's sufficient. That is quite common. Nothing to worry about that.
Okay, sir. Thank you. And next question is from Dr. Adhina. Sir, how we can manage the borderline hepatomegaly with no clinical symptoms, a normal LFT, and history of diabetes mellitus and thyroid disorder, and also with hyperlipidemia. The patient is a lady with a 38-year-old, and she known to know this hepatomegaly during a routine health checkup, and her BMI is 23. So what will be the treatment protocol for this case?
Can you repeat once again, madam?
Yeah, sure, sir. Sir, the patient is a lady with a 38-year-old, and the BMI is 23. And during her normal health checkup, she knows that hepatomegaly, borderline hepatomegaly, and without any symptoms. And she is having normal LFTs and history of diabetes mellitus and thyroid disorders and hyperlipidemia. So what will be the treatment protocol?
This is a multiple system involved diseases. So always start with Pachana. Then don't go for worry as it's not infected or nothing. Still nothing to worry about that. So generally the thyroid should be treated separately. And whether if you want to switch over to the Ayurvedic medication, that we have to analyze the duration of hypothyroidism treatment and the symptoms, etc. As per the reports, just we can go for this, the treatment protocol which I explained in the NAFLD Achyuta variety. So that is sufficient.
Okay, sir. The next question is from Dr. Shivakumar. Sir, in secondary cases, secondary metastasis cases, if liver is affected, there will be a jaundice. So, do you have any experience in such cases?
I don't handle CA or metastasis cases. So I'm not experienced.
Okay, sir. So we have completed. Next one is in Abhijit from Dr. Abhijit. It's a case report, sir. I will explain. A case of cryptogenic liver cirrhosis with a mild jaundice and mild ascites. Advised for liver transplantation. It's a lady patient with a 32-year-old. Then fibroscan score was 26.3 after 1 year of treatment, becomes 18. Then after 6 months, total 1.5 year become 12 with a complete symptomatic relief. Then the patient stopped medications for 6 months and took some Ottamuli treatment from a local Vaidya and again came back to OPD with a mild jaundice and minimal fluid, that is mild ascites. Current fibroscan score again worsened to 27 came. No, 27 came. Then, but the patient is not having much symptoms. Till now, no Shodhana procedure done. And can we do the Shodhana like Virajana in such cases of liver cirrhosis at this stage?
There can be, so actually I'm not able to a conclusion. So without seeing the patient, it's difficult. But still, if the other parameters are, especially the vitals, etc., are normal, not a purgation, but a normal virajana can be, a regular virajana can be performed. Always be careful that there can be some kind of electrolyte imbalance. So if in such cases, that should be supplemented with proper electrolytes. Otherwise, normal virajana can be done. But I think this strong virajana or after this snehabana, etc., that may not be required here, or that may not be advisable here also. But better one will be try shamana therapy, and if it is not proper once again, then you go for a milder regular nitya virajana. That would be the better.
Okay, sir. Sir, I think Dr. Abhijit can contact Jithesh sir directly and you will get more conclusions.
Definitely.
Okay, sir. Sir, along with this, there is a word that is Ottamuli treatment. I want to know your views regarding this Ottamuli treatment, which is very famous in almost all over India.
Yeah, that's right. Ottamuli, that is, there are so many ekaushadha prayogas are mentioned in Ayurvedic classics, but always if it is from a qualified Ayurvedic practitioner, then maybe try, but not with the quacks. But always I prefer to go for a systematic therapy, not the Ottamuli. So I don't prefer that, to be frank.
Okay, sir. Sir, in hepatitis B conditions, can we make it into negative?
I don't think so. I don't have experience.
Okay, sir. Okay. Then I think we have completed almost all treatments. questions. Sir, one from my side. As we know, the allopathic doctors are now very much keen observed by to the Ayurvedic medicines. They are saying that by the usage of the Ayurvedic medicines, they are getting the patients with the liver conditions. So, what is your opinion, sir? By the presence of the heavy metals which are present in the RASAAYANAM like that, is there any chances, as they said?
I think this has to be dealt in two phases. One thing is there are so many Vaidyakrita complications. So as I explained previously,
Yes.
if Arogyavarthini is given for a longer time in hemolytic jaundice, or maybe in any other kind of alcoholic hepatitis for a longer time, this can create further complications. So there are such possibilities. Whatever, maybe I just took an example only, this Arogyavarthini. The other group of medicines also. Unless and otherwise, the herbal medicines usually won't create any issues as explained previously. But the main problem what we are facing is, even we ask the patient to take for a period of 2 weeks. They will be consuming that without asking us again, that the prescription will be repeated again and again without consulting us. So such issues are the main problem what we are facing. If it is treated if it is treated systematically, depending upon identifying the phases, identifying the protocol, the Pathasamprapti, usually that won't create any harm. This is what I have say.
Okay, sir. Sir, next question is from Dr. Sandosh. Sir, what is the treatment protocol in Wilson disease and how to analyze the dosha avastha in that case?
No, Wilson's disease does increase the serum copper level. The only possible way, just I tried in 1 or 2 cases, but it was not completely success, and only I could provide some symptomatic improvement. The only one thing is proper snehapana, then shodhana. We have to consider this as dushivisha. Again, as I explained previously. So the snehapana with the kalyana, it was with snehapana with the kalyana vikrita, and then virechana was given. There is a peya called as Koshatakyadi peya, explained in Ashtanga Hridaya Uttara Tantra. That is Koshatakyakniga Patha Suryavalya Amritabhaya Chenu Shirishaganihi Sarva Vishapaha. It's explained as Sarva Vishapaha. It's not available in the market, but still almost all the ingredients are available as ready. That's known as Koshatakyadi peya. So this can be incorporated. This kind of the peya or this paniya, etc., can be incorporated. And the single drug we can say as Yashadabhasma. Because zinc is it's not according to Ayurvedic pharmacology, but the zinc is zinc nanoparticles are considered as the chelating agent for copper toxicity. So here the serum copper level is increased. And so here, in this case, after this proper shodhana, I prescribed this Yashadabhasma as a rasayana for a longer duration. I could, for up to some time, maybe up to 3 months or 6 months, I could make these symptoms controlled as well as the serum level controlled. But still, again, the problem was reversed. So I feel a periodic treatment may be necessary, and later I lost the continuation with the treatment, the contact with the patient, and now I'm not aware of that. So the periodic treatment, maybe every 6 months or maybe every 1 year. So if we continue the therapies like this, that can be, the condition can be under control, but may not a complete reversal may not be possible.
Okay, sir. Then we can take the final question from Dr. Abhijit. The acalculous cholecystitis and the cholecystitis with the cholelithiasis conditions. So what can be the treatment protocols?
The same protocol which I explained in the symptomatic phase of the cholelithiasis. how the cholelithiasis is creating symptoms. Only once it is infected, or no, not infected, it's inflamed. So inflamed gallbladder is nothing but cholecystitis. So as I explained previously, the active phase and inactive phase. So the Shobharam, Pachanam, and Rekta Pitta Haram. This line can be followed in the cholecystitis also, not in cholelithiasis, as I explained, the normal. Whether it is with cholelithiasis or not, that's that's not an issue. The same Shobharam, Pachanam, as well as Rektapitta group of medicines can be given in this cholecystitis patient also. The only thing is there are some conditions where the patient has to be kept nil per oral. So in kind of, it should be very crystal clear that it's not a peritonitis or it is not a duodenal perforation. That's what I said. That's why I included these three differential diagnoses in the case of cholelithiasis only, because no, you can see this. No other cases that I didn't include. I have not included any kind of differential diagnosis. But yes, in the case of cholelithiasis or cholecystitis, it can the symptoms can mimic as duodenal perforation, maybe acute pancreatitis or maybe peritonitis. In all these three conditions, the patient has to be kept nil per oral. Any medicines given internally, this can flare up the condition. So in case of an active cholecystitis, if you are starting the treatment, it should be crystal clear that the patient is devoid of perforation or pancreatitis or peritonitis. So be careful. And in that phase, if it is sure that all these symptoms are not there or these conditions are not associated, then we can.
Okay, sir, we have completed almost all questions, and I'm sure the participants are now clear with their doubts. And thank you so much, sir. The session was very wonderful. Each and every participants are writing us. It was a wonderful session with a new knowledge to their knowledge, and we are expecting more sessions from you, sir. We will definitely contact you. Thank you so much, and thank you for this wonderful session. Thank you, sir.
Once again, thank you. Can I take leave?
Yeah, sure, sir. Thank you.
Okay.